excellent to know is those who are here this morning.
World Sight Day with you, Your Excellency. And I would also like to thank you for allowing us to work for the good people of Nigeria. As Noor Dubai Foundation, we are an NGO. We are part of the Mohammed bin Rashid Al Maktoum Global Initiatives. As you already know, His Highness Sheikh Mohammed bin Rashid is the Vice President, the Prime Minister of the United Arab Emirates, and the ruler of Dubai. And under him, under his umbrella, there are around 37 NGOs, each one specialized in a different field. So Noor Dubai, hence the name Noor, which comes from the light, we are specializing in preventing blindness and visual impairment. We have been active for many years in Nigeria doing cataract camps, which are outreach programs, providing screening, surgeries, medication, and classes for free for the people of Nigeria. 4 years back, we have signed an agreement with the state governor of Katsina, and we were active in revamping accessibility to eye care. So part of our program was to improve the infrastructure as well as the human resource to make basic eye care accessible for all. We worked for 4 years, and we already revamped 3 hospitals, 250 primary care centers, around 12 screening centers, and we also have a number of doctors, paramedics, and nurses. We have conducted over 11,000 cataract surgeries, 25,000 other treatments, including surgeries and distribution of glasses. And with that program, we've also introduced the School Eye Health Program, where we screened over 800,000 people between students and teachers, and we've provided them with classes. And I'm very proud to inform Your Excellency that all our programs have been measured and reported, and the impact of our program on the Sustainable Development Goals has also been reported and published. One of the major impacts that we've measured is the economic impact. Because we've been there for 4 years, we did a survey prior to starting the campaign, and then at the end of the campaign, or at the end of the 4 years. Prior to starting the campaign, we've noticed that around 97% of the people that we've helped and supported were living under the UN poverty line, which means that they were earning around $2 or less per day. After the 4 years of the program, we surveyed the same people again, and we found out that that percent has dropped from 97 to 21. And the reason for that is because we've noticed that there is a very high increase in productivity. Now, cataract is a disease that affects the elderly, so the majority of them couldn't go back to work, but they became active again, socially active, so they were less dependent on an escort, who is usually a younger person in the family. That person went back to school, and he found a job, and he became more productive for the entire family and the community, and that's why it impacted the economic standard of living. We've also measured the academic performance of the students and the teachers. And one of the results that we found out that there's an increase in the academic attention of the students in class that increased to around 85%, which means that a simple treatment of refractive error by providing eyeglasses to students kept them in school and make them academically better. And this year, the program comes to an end. When we say it comes to an end, that doesn't mean that we're going to close it down, no. But we're going to hand it over to the state government. And we're going to work with them by providing free surgeries to those who need it. But everything else is going to continue under the governance of the state government. We still have some optometrists who are under the scholarship of Noor Dubai, training in India. We're expecting them to be back in a year, and then to find jobs and to work for the government. So that's our program in Katsina. Now, we were very happy with the collaboration we had from Nigeria, for the Nigerian people, and the acceptance we had. So we decided to expand to another state. And this year, we're starting a program in Lagos. Now, because Lagos is different than Katsina, and by different I mean the number of people, the population is very high in Lagos. There's a high prevalence of diabetes. And as you already know, diabetes affects all organs in the body, including the eye. And there's a very high rate of diabetic eye disease that is a blinding disease. Once a person has diabetic eye disease that's advanced, it's very, very difficult to reverse the blindness. So one of the key factors in controlling blindness due to diabetes is to screen early and diagnose it and prevent it. So what we're doing in Lagos is introducing artificial intelligence to screen for diabetic eye disease. The artificial intelligence, the machines are going to sit in community-based centers. They're going to screen the community, around 12 centers, 10 to 12 centers, and only those patients who need intervention like laser or surgery or injections are going to be referred to tertiary centers. We also had the privilege in the past 2 days to meet with the governor of Lagos and some of the physicians, our colleagues in the government of Lagos, and we visited one of the major tertiary centers there. And we've explored the possibilities of upgrading the service of eye care so that it can include the diabetic retinopathy treatment. So we're going to provide also the laser machines and some equipments. And hopefully, by the end of the 3rd year of the program, we can reduce the number of blindness due to diabetic eye disease. So this is, in summary, what we're planning to do in the next 3 to 4 years. We're going to hand over also the program at the end of the 3rd year to the Katsina State, and we're going to monitor the work and continue working with them for the next 6 years. And we're going to update you regularly with the results of that program. Thank you, Your Excellency.
Thank you very much. His Excellency, Solemn.
I'd like to invite Her Excellency, the First Lady, of this visit. I know
we were counting even not the days, the minutes that when we're going to come over here. I was so excited this morning. We call each other when we're going to be here, when we're going to see you guys. And as I said, on behalf of the Nigerians and UAE, so this is the truth. And I swear to God, this is the truth. And I will push those people up to come over here because Nigerians is the best and deserve the best all the time. So I promise you, I'm going to push them. I'm going to be one step behind them. Okay? I'm going to keep calling them, and I want them to come even to Abuja here to do something here. And she said, okay, right? All right. Of course, yes. Thank you again, Your Excellency. We have some small gifts here, please.
Your Excellency, and I believe that God must have really chosen this day, which happened to be World Sight Day, for you to visit. And you are here to talk about, sights and, blindness and whatever plagues man with, our visual capabilities. And coincidentally, Nigeria, too, today at the State House, they have an event, which the Honorable Minister for State on Health, Dr. Alausa, is starting a program called Jiggy Bola. And the Jig, my husband's first name is Bola. And 24 years about ago, he too started something on blindness and sight for those who needed surgery. But the main one that was really popular was giving out, reading glasses for sight. And, it became very popular during his tenure as governor of Lagos State. And, they are starting to do that again. But that happened to have been the likes of Dr. Alausa, who happened to have been friends of his, older friends of his when he was in Chicago. Most of his friends then happened to be medical doctors. I didn't know why he chose to have friends in that field, because he was more in the finance, department. But most of his friends, when he became governor, they decided to help the healthcare sector in Lagos. And part of it was the Jiggy Bola, which they are starting again today for the federal government. So having said that, that's why one of my staff too is absent. I want to sincerely thank you, thank NOR Foundation for the great work and the humanitarian efforts and resources that you've put to help my country. And I believe that on behalf of Mr. President, I would say, we are very, very grateful for this wonderful collaboration. I couldn't just, it's as if you shouldn't stop, and there was, such great help and assistance to, fellow Nigerians that you've invested so much in. And I know you chose a state that I believe that they would have suffered a lot of blindness issues. I remember when I went to Katsina, I didn't know I was supposed to put on my sunglasses. So I thought, oh, they don't know me here, let me take out my sunglasses. And I came back with terrible eye infection, which lasted for months. Before it could even clear out. Even up to now, I can even tell you I'm still affected. The last eye test I took, even the doctors were a little bit worried, but I knew that time it was horrific. Then I can imagine maybe God just wanted me to have a taste of what the people there must have suffered, and then for me to hear that you've really worked extensively in Katsina, it's really heartwarming for me, and I want to say thank you. Thank you for the great work No Foundation has been doing, and I also read about what you wanted to do in Lagos with the AI technology, which, and I think that's where the world is going and making a lot of things easy. But I pray that we won't lose our humanity with us not being able to interact. But, we thank God for the new discovery, new innovations that, the world is really embracing, which has really helped a lot of people. Thank you so much for the school high screening for students. It's very, very important. Like you said, with all that, it will definitely affect productivity and also, economic impact, which you described, if you have sight. And that was my husband's excuse too, and why he had to go into that in about, 24 years ago. And sight is very, very crucial for anyone. And I pray that, the distribution of glasses, I think you'll do that in Lagos as well. So I can just thank you for all that No Foundation has brought to Nigeria. And we look forward to more states being impacted by, your gesture. And I love the idea that you take it one state at a time. And because if you decide to go around the country, the impact won't be this, impactful. You've really, really touched lives, and I believe that those people who have been affected, will be forever grateful. I thank you for this visit, Your Excellency Ambassador. I hope this won't be our last meeting. We look forward to seeing you, and thank you for all the kind words you accorded me today, and I'm humbled by it. We just have to do whatever we can when God gives you the opportunity to be in a position like this and see how much you can impact the lives that God wants you to touch. Thank you very much, and I pray that you have a wonderful time in Nigeria. And thank you. I pray you should just be an ambassador for the new face of Nigeria, and that is what we keep telling Nigeria. They complain and complain, and look at you telling us how rich culture we have, what good people we have, and you are proud to be associated with us. Nigerians should know what we have. We know, Mr. President do know, and that is why we are doing everything to bring confidence back to those who have been disenfranchised in one way or the other, and try to encourage them that this is a great nation, and a great nation indeed. Thank you so much for the visit, and travel safe when you go back. Thank you. Thank you.
For us, that one.
Thank you very much.
Thank you.
Thank you,
Thank you. And travel safe when you